Success after a prostate cancer treatment can be measured in a number of different ways. Of course, the doctors tend to focus on the success after a cancer treatment, and that's very important for patients as well. But as we've learned through the focal therapy clinic, men are often very concerned about other forms of success, like the preservation of continence and normal urinary function, and the preservation of sexual function. And so when looking at success, we have to consider all of these domains and not just one in isolation. When considering about the success from a cancer point of view, probably the best illustration of success we have is from observational studies, where we've looked at focal therapy treatments and monitored them over time and looked for evidence of treatment failure. And we define that as having to have surgery or radiotherapy as a consequence of a failed focal therapy treatment, or having to start hormone therapy, or very rarely, of course, patients may die of disease. But thankfully, that has not been a problem with any of the treatments in the time frames we're talking about. So when you look at the different treatments, allowing for one extra focal therapy treatment if needed, which affects maybe 1 in 5 men, it seems that after 7 or 8 years of monitoring, the success in terms of failure-free survival between surgery, radiotherapy and focal therapies is equivalent, and that gives us a lot of confidence when advising men. With regards to the side effect profile, it's very clear from all of the studies that the side effects from focal therapy are dramatically less. And so if men are considering, and they're considered to be suitable for focal therapy, and they're not sure whether to go with radical treatment or focal therapy, if they value the side effect profile more strongly than the certainty of cancer outcome, then bearing in mind that there are other treatments available if they are unlucky and have to have a retreatment, then they may choose focal therapy because it's a trade-off between these two competing issues. And with the lower side effect profile, people achieve a sort of greater benefit in the short term, and in the longer term, there are other options that they can address down the line if needed.